A woman suddenly lost consciousness while a fake doctor was performing an illegal laser treatment on her. And instead of taking her to the hospital, he shoved her body into a suitcase. He left this suitcase in his garage for weeks while her family and police searched for her.
Unfortunately, this happens. There are a lot of fake doctors, and because he was a fake doctor and she lost consciousness, he didn't know what to do. That's part of the problem. There are people disguising themselves as doctor out there. This is really horrible.
The bullet was shot at the car, shattering the glass before hitting her in the head. But somehow she stayed conscious as blood poured down her face. She was rushed to a hospital where doctors discovered the bullet lodged into her hair weave. You see, the tightly woven fibers had cushioned the impact on her skull, causing the bullet to bounce back out. And after being treated for her injury, she made a full recovery.
But some of these hair weaves are so thick and so tight, I can see how that would cause like a cushion like that and block some of the entry. When you get hit in the head, you can have a coup or counter coup injury, which can cause bruising on the brain, even though it doesn't penetrate the skull.
When you break your nose, the nasal bones shift out of place, making it hard to breathe and changing the way you look. To realign it, a doctor will gently push the bones and cartilage back into the right position. Then the nose is packed with gauze, and an external splint is sometimes worn, holding everything together to heal.
The only thing I'd like to add, usually it's best to do this in 10 days or less. Once you go past 10 days or 2 weeks, then it's going to be difficult to shift the bones back in place. You might need to go under anesthesia for that or have surgery in order to do that. If you miss the 2-week window, then sometimes you have to wait like 6 months for everything to heal, and then you have to do a reconstructive rhinoplasty to make things work.
Using a fine needle, the doctor inserts thin, dissolvable threads under the skin. These threads have tiny barbs that latch onto the underlying tissue. Once the threads are in place, the doctor gently pulls them upwards, lifting the eyebrows.
Eyebrow threading is a relatively new procedure, but the problems with it is that it usually doesn't last long, so it's not something I particularly use in my practice because surgery is much more predictable results. Some people do get 6 or 8 months out of them, but usually it's not more than a year.
The barbs anchor into the tissue, holding your skin in its new position. As the threads dissolve over time, they stimulate the collagen production to maintain the lift.
A lot of non-plastic surgeons do this. They say it's like a facelift, but it's nowhere near a facelift and nowhere near long-lasting.
When you use an inhaler, a cloud of medicine passes through the mouth and into the trachea. As this fine mist travels deeper, it reaches the tight, constricted muscles around the airways. The medication sends signals to the muscles to relax, causing the airways to widen. And as they open up, it allows the air to freely flow, which helps you breathe.
So this is true. A lot of these medications, which basically take an inhaler, can give you a lot of relief, especially if you're constricted. For some patients, especially severe exercise-induced asthma, this can be a life-threatening situation, and these inhalers can be life-saving.
He would bite down on a metal rod attached to his piano while he played. The vibrations from the piano traveled through the rod, into his jawbone, and reached his inner ear.
He was obviously a musical genius, and he relied on his internal musical vision and then these vibrations so he could compose music. Sometimes I heard he would saw the legs off his piano so he could feel the vibrations through his feet. A very intuitive person.
This is a compound fracture, and it happens when your bone breaks and pierces through the skin.
Ouch, that looks really painful. And this is a situation that really needs to be taken care of immediately.
To fix it, a doctor will cut open the skin and start to realign the bones.
Usually won't make such a large cut, but just enough to bring the bones back in.
Once they are back in the correct position, rods and screws are inserted. This keeps them securely in place, stabilizing the structure so the bones remain aligned while they heal.
This is something an orthopedic surgeon does, not necessarily a plastic surgeon, but if they have problems with getting infected or the skin, then a plastic surgeon is sometimes called in to help with the wound care that's covering the bones.
When you crack your neck, it forces your joints to move, which can sometimes cause small air bubbles in the fluid to burst, creating that popping sound.
Cracking the neck is by the displacement of the bones on top of themselves. It's as well.
But if you twist your neck too forcefully, you might tear the lining of a blood vessel.
Okay, so this would require a huge amount of force to tear the blood vessel. Possible, but huge amount of force.
In rare cases, this tear can lead to a blood clot forming, which might then travel to your brain. Once there, the clot might block blood flow and could cause a stroke.
Any blood clot in the major artery going to the head can break off and cause a stroke. A stroke is basically where a blood clot breaks off and it clogs up the smaller arteries as the arteries get smaller in the brain, and then that part of the brain may not get much oxygen. And if that's the case, that part of the brain may die or be severely affected.
If you break a finger, it can be gently moved back to its normal position. Then a piece of metal is placed along the bottom to support it.
Usually injections like lidocaine where you numb the whole finger so that it can be pulled into place. And then x-rays are taken before and afterwards to make sure the alignment's right.
This splint is wrapped with straps to hold it firmly in place, preventing you from accidentally moving it and causing more harm. And this allows the bones and tissue to have time to fix themselves. Weeks later, the splint comes off, and hopefully you can start moving it again.
When the bones are that far apart, that needs surgery. And those tubes on the sides are usually nerves. If those are broken, they're not going to come back. You're going to be numbing your finger. You need surgery for that.
A hair transplant starts with a doctor extracting hair follicles from the back of your head. These are carefully removed one by one.
Extraction method used is follicular unit extraction. It takes these tiny little punches like shown in this diagram. We do it in a wide area in a disorganized fashion, so you have intervening hair growing in and you don't end up with any bald patches back there. Those little openings close by themselves in 3 to 5 days, no stitches necessary, so at the end of the first week you wouldn't notice much going on except that you had a short haircut.
They each contain a few hairs. Then they are meticulously implanted in the balding areas. Each follicle is placed in a way that matches the natural growth direction of your hair. And once they've adapted to their new location, they'll begin to grow and fill in.
The only thing is we cut them down to 1 or 2 hairs in the front to give greater density and natural look, and we put it in a disorganized fashion so it looks extremely natural.
A dentist will aim the laser at your gum line, vaporizing the excess tissue if your gums cover too much of your teeth. The laser's beam can reach up to 900 degrees.
So at this temperature, it also kills bacteria, making it less prone to infection as well.
Instantly sealing the tiny blood vessels as it cuts through the gums. And this minimizes the bleeding and swelling, making recovery much faster. As it gently trims your gum line, more of your teeth are shown, giving you a bigger smile.
So in the right candidate, this can be a nice aesthetic improvement of your gum lines. Once again, if you have overgrowth or you have what's called a gummy smile, where a lot of the gums are showing.
A needle is inserted into your lips if you get filler. As the needle enters your lips, the filler is slowly released into the tissue. This filler is made from hyaluronic acid and attracts water, creating a plumping effect. And the filler integrates with your lip tissue, making it look more plump and lasting around 6 to 12 months.
Lips usually don't last 12 months. Very few do. It's more 4 to 6 months and it goes away. Where they really filled up someone's lips, you might need 2 syringes to get that full.